Good morning, my dear friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. So in the last class we were discussing about the treatment of cerebral palsy in terms of Ayurveda, and in that series we have discussed about the role of Shirodhara, Shiropichu, Shirobasti, etc. Now today we'll have the important topic, that is the role of Basti and how the Basti can be administered in the children and what are the precautions that have to be taken, what is the best way of doing it. Now Basti is the mainstay of treatment. It achieves the that means for the achievement of the improvement, so Basti is very important. Now what actually happens in case of cerebral palsy spastic type is Vata Vruddhi due to Dhatu Kshaya. As a result, there will be the concomitant Kapha Kshaya also. There is Vata Vruddhi, so relative Kapha Kshaya will be there. Why there is Vata Vruddhi? Because a degeneration is going on. Okay, it's a degenerative disease, non-progressive degenerative disease. So Dhatu Kshaya is there. So the excitatory neurotransmitters and neurotransmitters which are inhibitory, the balances get affected. The excitatory, meanwhile the inhibitory neurotransmitters are more or less, which create the imbalance at the cortex and spinal cord level. Now this particular imbalance may create the problem in the spinal cord or at the cortex level. So to correct it, we have to go for the Basti. How to go for it? Now, Mustadi Rajayapana Basti with the Mamsarasa and other Brahmana drugs and Vriksha drugs are most commonly practiced because we have got degeneration there. So Mamsam Mamsena Vardate, Mamsarasa should be there. Mamsarasa should be there. Okay. And that is one way of treatment by using Mustadi Rajayapana Basti. And that can be practiced when the patient is there in the hospital under your guidance. But when the patient is discharged in the home, what best he can do? So what we practice usually is Matra Basti. Matra Basti is daily indicated in the small quantities because when you give the Matra Basti daily, you educate the parents, they will do it in home also, residents also. So when you do this Matra Basti by Taila daily, particular Taila, it daily nourishes the Vata Sthana, that is nothing but Pakwashe. Pakwashe is Vata Sthana. Vata itself is get excited here, and gradually there is a modulation of the brain, which is a sthana of the Pranavata and as well as Udana Vata. Now Matra Basti can be provided by the Kshirabala Taila. Usually we will go for 10 to 15 ml daily. Prasarani Taila, Sahacharadi Taila. If some intelligent related problems are there, mental retardation, etc., intelligence deficiency is there, then we could go for Kalyanagrata, especially the autism, ADHD like conditions, we go for Kalyanagrata, Brahmi Grata, etc. If it is a spastic cerebral palsy, the drug of choice is always Prasarani Taila, Sahacharadi Taila, or you can go for Kshirabala Taila. Now, Basti can be also act in other way. So we have got the concept of gut-brain axis, and the stimulation of the gut-brain axis by continuously giving Matra Basti daily. So it corrects the gut-brain axis and indirectly it stimulates the brain. So I have already posted a separate lecture on talk on gut-brain axis and its effect and the mechanism of action. You can watch it also. So this is how the role of Basti is there. So especially in children, we cannot go for some heavy Bastis. Okay, so either Matra Basti is quite good, or you can go for Mustadi Rajayapana Basti in small quantity when the patient is admitted in the hospital. Another important aspect is the role of Medhya drugs. So Medhya drugs we will go for. The Medhya drugs, again we can classify these Medhya drugs into Vataja, Pittaja and Kaphaja, and accordingly we can practice. Medhya and Vayastapana drugs are best. Vayastapana means they re-establish the Vaya. The cells are dying here or died, and we want to re-establish we have to lengthen the lifespan of these cells. Vayastapana drugs. Okay. So Medhya and Vayastapana. Similarly, Samnyastapana drugs can be also used. Similarly, Vedana Stapana drugs are also used. Vedana Stapana means you are re-establishing the sensation. Patient has got a cerebral palsy, patient will have so many sensory issues also. So by the use of this Vedana Stapana drugs, you can re-establish the sensations. Once the sensations are properly carried into the brain, then the things will be remodulated. Okay. So major drugs helps in changing the brain environment and also strengthens the brain neurons. Now strengthening may be in the form of a change in the excitability or increase in the inhibitory neurotransmitters, creation of the new synapses in the brain or new circuits in the brain, and strengthening the cholinergic system. That is cholinergic system. Adrenergic is excitatory, so we have to control the excitatory. So the commonly major drugs will have Ashwagandha, Vidari, Shatavari, Guduchi, Yashtimadu, Punarnava. Now we need to classify it Vataja, Pittaja and Kaphaja. Now here the Vata is more, so Vata Hara is very much important. Shatavari, Ashwagandha. Then we have got Vidari Gandha, then Yashtimadu. So these are some of the Vataja Medya Shamaka drugs. Okay, come to the Pittaja. Grita is the best Pittaja Medya drug. Whereas in case of okay, the first one is this Vidari, Shatavari, Guduchi. They are Vata Hara. Okay. Okay, for the Pitta, we have got Gritas, that's the best one. Kafahara, this Vacha, etc. drugs are there. So they are Vacha, Jatamamsi, etc. So they are Kafahara drugs. So likewise in the major drugs also we can classify. So another method is Pattabandhana method. Already we have discussed it in the context of Svedana. Okay, this Pattabandhana is quite useful in contractures and also it prevents the tendency of formation of contractures. Drugs are prepared into the kalka and applied over the thin cloth and then formally applied over the affected limb and later tied with the aranda leaves and tied with a hard cloth or some other mechanical support like cartoon, some thick binds, etc. Okay, so method is almost the same to that of Upanaha Sweda. Management of constipation is another issue, especially in case of cerebral palsy. Spastic cerebral palsy. Spasticity can occur in all the muscles of the body. It also occurs in the muscles of the puborectalis muscles of the rectum also. Therefore, usually in case of cerebral palsy, spastic type, you will also have a patient complaints of constipation. That constipation is not because of other dietary issues. That is because of the contraction of spastic puborectalis muscle which is blocking the rectal pathway. Okay. So, daily introduction of this Matra Basti is quite beneficial for that purpose also. Cerebral palsy patient will also have different other problems. He will have sleep problems. He will have posture problems. Okay, he will have pain because of spasm of the muscles. Okay, so all these problems has to be attended. Now, different phases of hypertonicity which needs to be looked for. So patient may be coming at different phase for you. Increase in muscle tone will be there. Sometimes spasm, involuntary contraction may be there. Clonus may be there. Pain and discomfort may be there. Then you have to take care of the hygiene problem, abnormal posture, contractures, tightening, bone and joint deformity, lowered quality of the life. So these are the different issues related to this hypertonicity. Sometimes we have to also go for some of the nidrajana drugs, sedative like drugs are required. Mild sedative drugs are also useful to combat the hypertonicity. Okay, Kola, Badara, Tagara, etc. Some of the drugs are there which are having nidrajana properties. Certain dopamine containing drugs like Kapikachu and Masha, so they are also quite useful because it is chemical contents of Kapikachu and Masha. It contains dopamine, so dopamine is one of the very important drug in the motor cortex level. Different drugs which carry the neuron regenerating quality. Now some of the drugs, these drugs can be given in the form of the Kshirapaka to the child. Okay, Kshirapaka. Okay, Bala, Prasarani, Kopilu, Jatamamsi, Vacha, Masha, Kapikachu, Yashtimadu. So these are the different drugs which carries the regenerating property. And there we can also go for some of the drugs which are having Rasana properties like Ashwagandha, Bala, then Vidari Gandha we will have. Then we have got Punarnava, we have got Guduchi. So we can make the Kshirapaka of all these drugs and then it can be given to the child daily twice or thrice. So this is what actually we have to understand regarding the treatment. Now if I go for my prescription in cerebral palsy, so this is my prescription that I will discuss in the next class. So that will be the last class. So thank you very much for being with me. In the next class we will see the last part of cerebral palsy treatment, especially spastic cerebral palsy. Thank you very much.